This is our Catch Me If You Can case report by Kylee and Emma.
So our character was Frank, and he is a talented teenage con man, and he cashed millions of dollars in forged checks, and he had to because he was running away from home at age 16 because of his parents' divorce. The agent that is on his case tries to catch him a lot of times, but Frank remorsefully gets away each time. The film is based on the culture of obtaining the American dream, and Frank chases it in his wrongful behavior of stealing. In reality, he doesn't need to catch so many checks just to survive, and he could just get a job, too. He only continues it because it's a protective survival strategy that he's developed due to his low economic status, and this is a cultural cause of the antisocial personality disorder.
Alright, so we obviously diagnosed him with antisocial personality disorder, which occurs when an individual expresses an immense amount of carelessness towards the consequences of their actions on other people. The symptoms are impulsive behavior, failure to follow the law, lack of guilt, and frequent intention to mislead others.
So to be diagnosed with this disorder, you have to be of at least 18 years old, and you have to have symptoms from beginning before 15 years old. Frank starts out as a 15-year-old in the movie, but he surpasses 18. He's well into his 20s by the end of the movie, and so we decided to still diagnose him with ASPD.
Alright, so the cultural aspects in this diagnosis is that criminals are often stigmatized with having this, and if Frank was to go to a therapist in the 1960s, it's going to be a lot different than it would be today, because psychiatrists back then didn't have as much knowledge about mental disorders and its consequences. In some stricter cultures, such as China and Russia, ASPD is even less frequently diagnosed due to the cultural insensitivity to uncommon personality disorders. And in our culture, the stigma is kind of where we draw the line at when a disorder is an excuse versus when a disorder is a cause of criminal action.
So his first symptom is his tendency to not respect law, which is when an individual doesn't follow social norms by not following the law, committing actions ground for arrest, or disregarding the rights for others. Frank repeatedly forges checks, even though he's been told this is wrong and unfair to society, and he has no need to steal such a great amount of money, and he feels no guilt for it. His second symptom is consistent irresponsibility, which is when an individual displays irresponsible habits like the inability to attain a job, financial debts, or frequent absences. Frank is consistently irresponsible in that he continues to forge checks and run from the government even though he could easily obtain a job like the rest of society, and there are plenty of jobs available to him. His weakest symptom is the little remorse for actions. This is when an individual may lack empathy, fail to make amends for their behavior, or understand their behavior is wrong. Frank often shows little remorse for stealing money from banks, even when he tricks Agent Hanratty out of catching him. However, there comes a point when he breaks. The film shows his sadness and weakness behind his actions later when he is in jail, and Hanratty saves him, and he uses his talents to instead help and contribute to society by catching other check forgers.
Alright, so the most common treatment for people with ASPD is cognitive behavioral therapy and group intervention therapy, which we're going to recommend for Frank so that he can kind of understand himself better by seeing his personality traits in others, and it's going to show him how certain way he acts are wrong. We think that Frank has a comorbid disorder, which means that other disorders are going to be associated with this, so we think that would be good for him too. The ethics of this treatment is obviously the legality and the cost associated with it, and is it okay to pardon his criminal injustice because he suffered from a mental illness, and is it going to be a disorder characterized by civil disobedience? So we just really don't know what the right option is. So the societal barriers behind this treatment is obviously the social rejection, because in the 1960s, people with ASPD were psychopaths. This resulted in kind of the psych ward treatment and psychiatric hospitals and just maladaptive treatment because doctors didn't believe that these patients were going to settle down and they were viewed as unlikely to heal.
So the film does not portray the childhood behind Frank, and so we don't know if he had symptoms of ASPD before 15, and so that is something that the movie doesn't portray well and is needed for diagnosis, but we just assume that he does have that. But the movie does do a really good job at setting aside his criminal behavior from ASPD and showing a personal aspect to his life and how he carries ASPD into that too. He lacks emotion for leaving his fiancée at the airport in order to escape prison. It also portrays a very accurate ASPD in that he has very strong symptoms, and it really shows how he struggles in it. It also sets aside criminal behavior. It's not the leading reason for his diagnosis, and it shows us, it influences our understanding of the disorder because it gives us a lens into the human behind the disorder, which is Frank in this. Most medical and legal professionals grapple with how to understand and help the individuals in ASPD because they don't want to give an excuse for the individual's wrongful actions, but there lies a medical reason for the actions further than just moral inadequacy, which can be seen by looking at other